Magandang umaga sa inyong lahat. Nandito na naman tayo ngayon para pag-usapan ng isa na namang importanteng topic na lumalabas not only in the board exam but in our NCLEX review. And nakikita natin to kapag nag-answer tayo ng mga question or mga practice questions natin sa ating board exam review. Kaya kailangan natin itong pag-aralan at kailangan nating malaman or di ba kaya kailangan nating intindihin kung bakit ito nangyayari sa ating mga pasyente. And this disorder is what you call your thromboembolism. Are you familiar with that word? Okay, your thromboembolism. I'm sure you are familiar with this one. I'm sure that the term also rings for those who are reviewing this. For those who have reviewed or have lapsed, yung mga hindi nagre-review for let's say mga 5 years na, I'm sure it still rings a bell. It still rings a bell yung nag-self-review dyan. Okay? Now, one thing that I'm going to discuss about thromboembolism is a triad. Anong ibig sabihin ng triad? At anong ibig sabihin ng triad at bakit ko kailangang i-discuss ang triad para maintindihan kung bakit nangyayari ang thromboembolism. Pwede nating isipin guys na ang thromboembolism ay may tatlong triad siya. Ano yung triads na sinasabi natin? Ito yung mga condition na kapag nakita natin sa pasyente ay usually malaki ang tsansa na mag-develop sila ng tinatawag nating thromboembolism. At itong ang triad na ito ay tinatawag nating Virchow's triad. Okay? Yun nga yung sinasabi ko, ang Virchow's triad ay mga condition or mga parameters na ginagamit natin para i-predict or para malaman kung gaano kalaki yung risk ng pasyente natin na mag-develop ng tinatawag nating thromboembolism. Ang una sa mga Virchow's triad natin na makikita is that there is what you call endothelial injury. Okay, endothelial injury in general is damage to the lining of the blood vessels. Ano ang cause nito? Either nagkaroon ang pasyente ng trauma, ano pa? Inflammation, surgery, o recent infection. Okay, those are endothelial injury. Bakit? Anong nangyayari dito? Okay, trauma, inflammation, surgery, recent infection. There is damage to the inner lining of the blood vessels. Okay, so that is what you call endothelial injury. Number 1 sa Virchow's triad natin. This is the primary. But this is not, there is no particular order of priority. In which case, hindi important ang isa above the other. As long as you see two or all of this in a particular patient, then the chances of developing thromboembolism will also increase, right? So that's what you have to instill in mind. Number 2 is what you call abnormal blood flow or the disruption in the blood flow patterns of the patient such as turbulence, stasis, yung mga ganyan. Bakit? Whenever you have what you call a disruption in blood flow, there usually is what you call slowing, right? There is what you call slowing or stagnation of blood flow. Anong nangyayari kapag there is abnormal blood flow? Kapag na may slowing sa flow of blood ng pasyente natin, there is an increase in clot formation. Okay? There usually is an increase in clot formation. Okay? Next would be what you call your hypercoagulability. Okay? Hypercoagulability is the alteration in the balance of clotting factors. So, anong nangyayari kapag may hypercoagulability ka? Okay? When there is an alteration of clotting factors in the body, there is an increased tendency, again, for blood clotting. So, ito pa rin, increase in clot formation. So, all of this guys, in general, in retrospect, all of these three increases the chances of the development of what you call your clot, which is one of the markers of thromboembolism. Kaya, bakit nga? Because you need clot formation eh. You need clot formation in order to consider that thromboembolus, right? So, thromboembolism usually happens when there is endothelial injury, kagaya ng surgery or kagaya ng trauma. And then, when usually kapag nag-surgery ang patient, you will undergo bed rest, right? Bed rest. Nagbe-bed rest yung pasyente natin. Kaya there is usually what you call stasis. Okay? Or stasis. Ano nga yung stasis? There is a stagnation of blood in a particular body area or a local in the body. And then there is after there is stasis, there is usually when the patient's blood is in stagnation, there is hypercoagulability. Okay, there is hypercoagulability. Nangyayari yan when there is stasis in a particular part of the body. It increases the chances of clotting in that body, in that particular locale in the body. One common example of that, when you have a turbulence, okay, and another form of stasis, a turbulence in a particular valve in the body, right? Or in particularly in the heart. Anong usually ina-administer ng doctor kapag may tinatawag tayong turbulence in the heart or in valve in the body? Because valves are not only seen in the heart, they are also seen in the blood vessels, right? Especially to mention in the large veins of the legs. Kapag may turbulence guys, and then na-detect yan ng doctor, isa sa mga usual na medications na ginagamit or ina-administer as a protective mechanism to prevent clotting is your aspirin, right? Aspirin. Bakit ina-administer ng aspirin? Because turbulence or yung black backflow of blood increases the chances of coagulation or blood clot formation, and therefore your abnormal blood flow such as turbulence, stasis, increases the chances of clot formation. So ito, kung may abnormal blood flow ka na, +1 ka na agad, hypercoagulability agad. Right? So there is already a +1. If you have abnormal blood flow kapag nakabed rest yung pasyente mo for prolonged periods, you also have to have considered the risk of hypercoagulability in your patient. Nakuha ba? That's very good. So now, let's continue. Now, thromboembolism, guys. Thromboembolism, ang cause ng thromboembolism, yung sinabi natin, is when you have a patient that is immobile. You have decreased mobility, impaired circulation that leads to the development of what you call your thrombosis. Now, may tinatawag din tayong intracardiac emboli, which is common in atrial fibrillation. Bakit nangyayari? Because in atrial fibrillation, guys, the heart beats so fast. Okay? The heart beats fast, but the heart's beating is inefficient. Okay? Inefficient siya. So, anong nangyayari? Nagba-backflow. Okay? Nagba-backflow yung blood sa heart natin. Okay? Ano yung sinabi natin? When there is backflow, there is turbulence, there is abnormal blood flow. Okay? There is abnormal blood flow and increases the chances of hypercoagulability. Kaya, it increases the chances of intracardiac thrombi. Kaya common to sa atrial fibrillation, not only in atrial fibrillation but also in heart failure, post-heart failure patients natin. Okay, post-heart failure patients. Now, it can be detected by the use of what you call electrocardiogram. Okay, by the way, guys, I will be sending and I will be giving you the notes or the transcript for this video. Don't worry, you just have to listen. Again, this is my homepage now for those who are self-reviewing. Okay, so this is my gift to you now. These are my lectures I will be giving to you. No need to I'm not asking you to pay. I'm not asking you for anything in return. Just as much as possible, take everything that you can in this video and then use it and then practice it in the exam, and that would give me the greatest gratification there is. Okay, so let's continue. Now, in the thromboembolism, there is usually the common treatments in thromboembolism. Thromboembolism is treated by heparin or warfarin, but there are also other meds. But we're not talking about meds here. We're talking about the common pathologies, the intervention, at saka yung patient health teaching natin. Because usually common drugs that are associated with your thromboembolism includes your arteplase, yung mga ganyan, which I will mention later on in this video. Okay? So, pulmonary embolism, another common na lumalabas sa board exam, which is also a classification of thromboembolism. Now, it's again common in patients with heart failure. Now, it's a life-threatening thromboembolic event. Ano bang ibig sabihin ng thromboembolic event. Thromboembolic events are a general term used to describe when there is a clot formation, right? When there is a blood clot, then the blood clot travels along the blood vessels and causes blockage on those blood vessels. Okay? Causing tissue damage or organ dysfunction. So, yung thromboembolic events, hindi lang yan, hindi lang yan limited to pulmonary embolism. Anong ibang example ng thromboembolic events? Your stroke. Ano pa? Your TIA, right? Transient ischemic attack. Ano pa? Your MI are thromboembolic events, right? So, very good. Okay, so, anong clinical indications natin when you have pulmonary embolism? Because I chose to describe pulmonary embolism as a part of a classification of thromboembolism because in your medical surgical nursing, it is formatted as that way. Okay, right under thromboembolism, there is a special what you call this special section for pulmonary embolism. So it can be regarded as a disease with high relation. Okay, kaya sinali ko na to. Okay, but again, thromboembolic events are not limited to pulmonary embolism. They can be again stroke, TIA, MI as it as long as it fits with the description wherein the blood clot travels and blocks the blood vessels causing tissue damage or organ dysfunction, then that is a thromboembolic event. Now, clinical indications natin for pulmonary embolism is what you call your dyspnea. Anong dyspnea nga? Ano nga yung dyspnea? Dyspnea is difficulty breathing, ano pa, chest pain and tachycardia. Okay? Those are our signs and symptoms of pulmonary embolism. And diagnostic test usually conducted for pulmonary embolism is chest X-ray, lung scan, and computed tomography. Now, computed tomography, are you familiar with that? Sa mga hindi familiar, yung computed tomography ninyo is also what you call your CT scan, right? CT scan. Anong ginagawa ng CT scan? Okay, ang CT scan, ang ginagawa niya is it combines X-rays with the computer, okay? With the computer technology. Okay, anong ginagawa nito? When you combine X-rays and computer technology, you are able to create more detailed, okay? More detailed, increased detail in the pictures that you produce. And for one, it increases or it allows the imagery of the cross-sectional, okay? Cross-sectional area of the body. So in general, it can be used as an indicator of pulmonary embolism because it can be used to detect whether there are impairment in blood flow in certain areas of the body. Okay? Now guys, mayroon din naman tayong tinatawag na D-dimer. Okay, ano tong D-dimer? Okay, D-dimer is a protein fragment, okay, that is released into the blood when a blood clot breaks down. Okay, so let's say you have a blood vessel right here. Okay, may damage yan. Ano nga yung ano natin, yung Virchow triad? Number one is endothelial injury. Okay, when there is an endothelial injury, pag may sugat yung blood vessel mo, ano mangyayari? Okay, there will be a formation of blood clots in those areas in order to repair. Okay, the repair process, endothelial injury repair process is a good process. It's not a pathologic process. It only becomes a pathologic process when it damages, the process itself damages an organ or a tissue as a consequence of its blockade in the flow of blood in the particular tissue. Now, again, when you have endothelial injury, there is clot formation in those areas. Now, when there is clot formation, it aims to repair the endothelial injury. Now, over time, as the clot progresses and as the endothelial injury is repaired, there is fragmentation, okay, of this mga clots dito, and the fragments that are usually left in the bloodstream is what you call your D-dimer. Okay? Yan yung tinatawag nating D-dimer. So D-dimer is an indication that there is a clot formation. Okay? Indicates the activation of the clotting system. Okay? There is clot formation or clot breakdown in the body. Okay, there is clot formation and clot breakdown in the body. Okay, and it also determines the fibrin presence, which is a component of the coagulation cascade. Di na natin yan kailangang i-discuss kasi that's an in-depth biochemistry naman. Okay? So, next is thromboembolic therapy for massive emboli. Anong mga kasing thromboembolic therapy natin dito? Okay, so anticoagulant therapy, yung na-mention natin is heparin and low molecular weight na heparin. There are the thrombolytic therapy for massive emboli, and they can be considered long-term therapy as well as warfarin. Now, this all of this, heparin, warfarin, low molecular weight heparin, can be used to prevent deep vein thrombosis in pulmonary emboli, right? Now, there's also stronger thrombolytic agents, right? And I'm sure na-mention ka na to kanina. This is your places, right? Your um, your altiplase, reteplase, or teneclic place. Those are your strong thromboembolic agents. Now, when you have a patient that is undergoing heparin, warfarin, or all of this as a consequence of treatment for thromboembolism, you have to understand that the action of all of these drugs is either to decrease clot formation and increase the breakdown of clots. Okay? Okay. Now, yung sinabi ko kanina, is clot formation a bad process? No, it's not a bad process. It's actually a protective process by the body, uh, placed in there to repair any damaged organs or tissues, right? So, when you are administering thromboembolic therapy, you have to understand that okay? You have to understand that you are inhibiting one of the most important processes in the body, the repair process. And therefore, if undergoes or the patient undergoes any trauma, any damages, or anything like that, the patient will be highly susceptible for what you call your bleeding. Very good. Your bleeding. So in general, in anticoagulant therapy, in thrombolytic agent therapy, your priority intervention should be to monitor the patient for increased risk or potential for bleeding, which can immediately or usually very fast becomes severe. Okay? Severe. Bakit nga? You are inhibiting the one of the repair processes of the body, which is your clot formation. Okay? Tandaan nyo yan. Tandaan nyo yan, guys. Okay, very good. Next, patient management and complications. Isa sa mga complications na nakikita natin sa ating thromboembolism. Okay, isa sa mga complications na nakita natin sa ating mga patients with thromboembolism is what you call your hypoxic vasoconstriction. And let me explain this very quick. Okay, when you have a vessel like that, usually yung mga thromboembolic events natin is not a full occlusion. Okay, hindi yan siya full occlusion. Usually, ang nangyayari is there's only partial occlusion in, let's say, may natira pang daanan ng tinatawag nating blood vessel, right? May natira pang daanan dito ng mga blood. Now, there is decreased blood flow to this particular tissue. Let's say, Let's say ito yung adrenal cortex natin. Okay? This is the tissue that is supplied by this blood vessel. Okay? So, and by the way, to mention, your kidney structures are one of the most susceptible na organs pala for any disruption in blood flow. Okay, so when you have a blood vessel that is disrupted by a clot, okay, or a thromboembolus, and then there is no full occlusion of the particular vessel. There is only partial occlusion and makaka-flow pa yung dugo dito. Anong nangyayari? Anong gagawin ng body in this scenario? Well, the proximal, yung natira or yung part from here to here, okay? Itong blood vessel na to, this part will think that the body is losing blood, right? Losing blood. Either from hemorrhage, right? From hemorrhage, ano pa? Ano pang mga causes ng or blood components ba kaya? Like kagaya ng dehydration, HN, right? So the proximal part thinks that. And one of the common responses na ginagawa ng mga blood vessels in order to compensate for a decrease in blood in that part of the body is what you call your hypoxic, what you call your vasoconstriction. So, anong nangyayari? Nililiitan niya yung blood vessels mo para ma-maintain yung blood pressure, para makadaloy pa rin ng mabuti yung dugo towards this particular tissue. Okay? So, nagva-vasoconstrict siya. So, anong nangyayari? Imbes na partial occlusion lang yung nangyayari, there is constriction and there is full occlusion na nangyayari. This is what you call your hypoxic vasoconstriction. Again, this refers to the narrowing of the blood vessels in response to low blood oxygen levels as a consequence of low blood supply to those areas. This is again a protective mechanism that becomes pathologic very, very quickly. Now, another complication that we need to look out for is the potential for right-sided heart failure and respiratory failure. Why? Because as the clot travels to the bloodstream and lodges into the pulmonary arteries, kapag nangyayari yan, the most common talaga na lugar na pupuntahan ng blood clot is your lungs. And it causes what you call your pulmonary embolism. When that clot blocks the pulmonary arteries, it leads to increased pressure in the pulmonary circulation, right? When increases pressure in the pulmonary circulation, it increases subsequently the pressure in your right side of the heart, which is pumping blood to the pulmonary circulation. And therefore, there is an increased risk for right-sided heart failure and respiratory failure. Okay? So ano pa? Oxygen therapy is indicated as a management for your thromboembolism. Bakit? Anong goal nito? It is to relieve, okay, hypoxemia. To relieve hypoxemia. And finally, yung minention natin kanina, it is to treat with your anticoagulants, heparin, warfarin, or thrombolytic agents, your places, your antiplace, your retiplase, yung ganun, yung minention natin kanina. Okay? Ano pa? Now, you need to look out for, or as a nursing intervention natin, you need to look out for the respiratory status of your patient. Bakit? Your respiratory status, yung sinabi natin kanina, the patient will be at risk for respiratory and cardiac failure. So you need to assess the respiratory status of the patient. Now, another thing that is a priority of nurses is pain assessment or pain relief sa ating mga pasyente. Bakit kaya? Bakit? Because yung thromboembolism, napakasakit niyan. Isa nga sa common na thromboembolic event is DVT, yung deep vein thrombosis. And anong pathologic or pathognomonic sign ng DVT natin, it is your human sign, your positive human sign. Okay? Yung positive human sign is when you dorsiflex the foot of the patient and you elicit pain upon dorsiflexion. Okay? So meaning, may pain. Okay? May pain as a component of hypoxia on tissues, right? So, you need to administer pain relief and pain assessment as well. Okay? So, remember that another priority for that is pain assessment and pain relief. Ano pa? Reperfusion arrhythmias. You need to look out for what you call reperfusion arrhythmias. Anong ibig sabihin ito? When an MI happens, or let's say a partial occlusion of cardiac vessel happens, kapag you administer thrombolytic agents, kapag nag-administer ng anti-clotting, okay, like for example, warfarin, heparin, yung mga ganyan, okay, warfarin. Once na nag-reperfuse, anong ibig sabihin ng reperfuse? Once na dumaloy na pabalik yung blood doon sa area na yun, there is a possibility that the restimulation and the reperfusion or ang pagdaloy pabalik ng dugo sa area na yun causes what you call your arrhythmias. Okay? So that is what you call your reperfusion arrhythmias as a result of the restoration of blood flow. Okay? Blood flow to the area. Okay, I'm really sorry for the bad handwriting. Next is vital sign and bleeding, allergies as well. Now, I will highlight allergies and your drug interactions, okay? Because your warfarin reacts with a lot of drugs. And that's why one thing that I will say to you when you are asked in the board exam, what should be the nursing intervention when you are administering warfarin in the patient aside from looking out and assessing for bleeding of the patient, you also need to look if the patient is taking any over the counter medications. Why? Because again, warfarin reacts with many drugs that are over the counter, and therefore it increases the chances of side effects and bleeding. Okay, so guys, those are the conclusion of our thromboembolism discussion. Now, let's try to answer several questions in order to refresh our knowledge upon the discussion that we recently had. Okay, number one. Okay, scenario. Sarah, a 50-year-old woman has been diagnosed with pulmonary embolism daw. Which of the following treatment is indicated for Sarah's condition? Okay, for a 50-year-old diagnosed with pulmonary embolism, the priority talaga ng kapag may recent pulmonary embolism sa pasyente natin is to administer what you call your drug therapy. This is the priority natin dito to improve to improve oxygenation, O2 supply, as well as to relieve hypoxemia in patients natin. Okay? Number two, David, a 65-year-old man, has been prescribed warfarin for long-term anticoagulation therapy. Which of the following statement by David indicates a need for further education about warfarin therapy? A, I need to have regular blood tests, monitor my INR. B, I should avoid eating foods high in vitamin K. C, okay, need for further education. So ano yung mali dito? Ano yung mali dito? Okay? Ano yung mali na mga statements dito? I need to have regular blood tests. Of course, you need to have regular blood tests in order to determine the therapeutic level of the drugs that you are taking. Ano pa? B, I should avoid eating blood. Yes, because vitamin K impairs with the action of warfarin. Okay, vitamin K is the natural. Okay, this is the natural antidote. Antidote for the warfarin. Meaning, kapag nag-warfarin overdose ka, kailangan mo mag-take ng vitamin K in order to offset the effects of the overdose of the warfarin. So, avoid eating warfarin if you want to have a effective avoid vitamin K if you want to have effective anticoagulation therapy using warfarin. I can take over the counter pain relievers without any concerns. Yan ba? Is that correct? Or D, I need to wear a medical bracelet, which is correct. So the correct answer for this one is letter C. Okay, I can take over the counter pain relievers now without any concern. One of the common pain relievers that interacts with warfarin is your NSAIDs, right? Your NSAIDs, which also has anti-inflammatory, anticoagulation to some effect. There is an anticoagulation effect because it affects with the inflammatory responses of the body. Okay? So isa yan. Yung mga pain relievers natin na OTC should be counter-checked if your patient is undergoing warfarin therapy or in general anticoagulation therapy. Okay? Next is Mark. A 60-year-old man has been diagnosed with deep vein thrombosis, or what you call your DVT. Which of the following intervention is a priority for preventing complications in Mark? Okay, if you have a patient now who is diagnosis with DVT, which is the following interventions are your priority? A, bed rest and immobilization. B, application of warm compress to the affected leg. C, ambulation and leg exercises, or D, administration of anticoagulant medication. The best intervention, the priority intervention in preventing complications of MARC is to administer anticoagulant medication. Okay? Anticoagulant medication prevents the complication of DVT. Anticoagulants such as yung minention natin, heparin or low molecular weight heparin can help prevent the formation of blood clots and reduce the risk of embolism and further complication. So the best answer for this one is letter D. Last question. Lisa, A 40-year-old woman presents to the emergency department with sudden onset of dyspnea and chest pain. Pulmonary embolism is suspected to the patient. Which laboratory test can determine the presence of fibrin in Lisa's blood? Again, yung mention natin, when you have degradation of your clots, it produces as a byproduct your D-dimer, right? A protein that is a marker for fibrin degradation, which is a component of your blood clot. So the correct answer for this one is Bravo. So guys, that was a conclusion of our thromboembolus discussion. So if you learned something in this video, please do like, subscribe, and share the channel to your classmates or to your schoolmates. It would be a great help to the lecturers and the admins of this channel. Thank you so much, and I hope you learned something, and let's see each other in the next video.